to all the families that have lost their lives, the people that have lost their lives through the COVID-19, and also to the families that have died due to other illnesses, and to the families and the friends of the people that couldn't attend their funerals to show their respects due to the health criteria that are in place. To the Minister, I have questions on the payments, where the payment has been now increased from €203 to €350, which I welcome. But I'm getting questions every day from people that are part-time workers, that are apprentices, trainees, where their incomes might have only been €200, and they're afraid of, when they apply for this funding, that this be on the basis of 350, where they might have been only earning 200, or 250, or 300. Will they be in a position where they are going to be told at the end of this that they have to repay the balance if they've been overpaid? And they are worrying over this. Our frontline services are doing an amazing job, from the healthcare services to our shopkeepers to our chemists across the board are doing a fantastic job. If you were an apprentice bricklayer, a plumber, an electrician, plasterer, you get paid a wage while you do your training. Our frontline services, our nurses, do not get anything while they do their training, and should get an immediate payment of a subsidy to allow them to survive, as we do need all our healthcare staff. We also have people at the moment that are over 70s that are made to turn up to the motor tax office in person to renew their licences. And they have to travel by themselves because they have nobody that will take them, because they're afraid in case they pass on anything to them. This has to be changed. We have a banking sector that are freezing payments, which is welcome. But if you're on a term loan of 2 years, 3 years, 4 years, whatever way your term is, they will freeze it for 3 months, they will freeze it for 6 months, but they want the full payment within the term of the loan. So that means when this comes back to normality, you have to pay the full amount to them within the term of the loan. This also has to be changed. We have people that are in rental accommodation. We have people, because of this crisis, that are living in rental accommodation where they might have somebody elderly and they have their children with them because they are waiting on a housing list, are now looking for alternative accommodation so they can actually get the separation distance from their loved ones. So they are working. We have a lot of people that need to be looked after in this crisis. So, also from an insurance point of view, we have some insurance companies that have shown that they are liable. And we have some insurance companies that have shown that they are not liable in this. As a goodwill gesture, all insurance companies should freeze all insurance payments at this time for the same amount of time, for 3 months, to allow the businesses that had to close down, that you do not have to pay the premium, but also that their cover is held in place for the 3 months as a goodwill gesture. This has to happen, and it should be made as a law that this has to happen immediately. And afterwards, the companies that are liable can then be dealt with. But in the interim, for small to medium-sized businesses and large businesses, the insurance should be frozen and everything kept in place. If you are a hotelier, your insurance at the moment, you have to have somebody in the hotel 24/7, because otherwise your insurance is invalid. This again has to be brought up and also has to be introduced. Going back again to our nurses, if anything comes out of today, we have to ensure today that our nurses will get, our trainee nurses and our frontline staff immediately get a payment to allow them continue the frontline services that we are asking for them, for their help today. Thank you very much, Concord.